Also going back to school today, students across North Texas, Argyle to Arlington and Mesquite to Carrollton Farmers Branch. And with students heading back to school, it isn't only an outbreak of COVID-19 that concerns doctors. They're also worried about a measles outbreak, or worse, maybe an outbreak of both. CBS 11 I-Team reporter Brian New found that North Texas is actually right now at a higher risk than ever before.
Despite many doing school online this year, Texas is still requiring all students to get their vaccinations. But our investigation found many parents have put off these vaccinations or decided to opt out. When thousands of Texas parents canceled child wellness checkups this summer, many did it to limit their child's exposure to the coronavirus. But what doctors say they inadvertently also did was increase the risk of a different health crisis.
The last thing you want to do in the middle of a pandemic is have an outbreak of a different disease at the same time.
According to the Dallas County Health Department, the number of vaccines administered by the county is down by nearly 50% this year. Health experts say this only complicates a trend we've now seen for years in North Texas. Even before the pandemic, the number of families filing school vaccine exemptions was going up. In the past 5 years, vaccine exemption rates have nearly doubled in Tarrant County, more than doubled in Dallas County, while exemption rates in Denton and Collin counties are both pushing 5%, which is often considered the tipping point to maintain herd immunity.
A little pinch in that muscle.
As immunization rates drop in North Texas, doctors say the risk for measles, whooping cough, and other life-threatening illnesses goes up for everyone.
And when you're talking about not vaccinating, you're extending the risk that you're trying to assume for yourself to everybody else around you. And
Dr. Jason Turk is a pediatrician for Cook Children's. He says dozens of schools across North Texas are at high risk of an outbreak because of a high concentration of students who skip their vaccine shots. And this year, he says, with COVID-19, a measles or whooping cough outbreak at a school could stretch local health resources to the limit.
it gets really serious. It's not imaginary. It's not theoretical. It's real.
But there's yet another reason that all this has public health officials concerned. They're worried if a growing number of North Texas families are reluctant to get proven childhood vaccinations, what happens when there's a new vaccine for COVID-19?
My phone was ringing off the hook.
Jackie Schlegel is the founder of Texans for Vaccine Choice. Since the pandemic began, Schlegel says her political group has gone from 10,000 to 14,000 members. For years, her organization has advocated for the rights of parents to choose whether their children get their school immunization shots. But recently, she says much of the talk has been about preparing to push back against policy and doctors who push a COVID-19 vaccine.
What we can't afford to do is to put so much fear in our families that they can't even pick up the phone and call their practitioners. We hear this over and over and over again. There's gonna be a pandemic, there's gonna be an outbreak, and we are backing families into a corner.
Public health officials say a safe and effective vaccine could end the coronavirus pandemic. But for it to succeed, enough people would have to get it. So the question has come up whether the government could mandate people go and get a COVID-19 vaccine. As we know, the government requires students to get vaccinated before they go to school. But here in Texas, all parents have to do is fill out an exemption form to opt out. Now, legal experts told us that, especially here in Texas, it is far more likely that the government would go the route of simply encouraging people to get a vaccine through educational campaigns. With the I-Team, Brian New, CBS 11 News.